Hi, everyone. A good evening to those of you joining us from Asia. Good afternoon to those who are joining in from Europe and Africa. And a very good morning to those early risers who are joining us from the Americas. We hope to deliver an engaging and interactive session over the next 90 minutes, mostly on account of the four amazing nonprofit founders I have with me today from India. This session on participative problem solving is to some extent focused on COVID. Not only was the pandemic debilitating from a health and economic perspective, it was also especially painful for the social sector, definitely in India. As we entered one of the strictest lockdowns in the world, we saw organizations lose their ability to do interventions on the ground and hence the ability to impact their target audience. Of course, this was not the story all around. And a significant number of organizations, after deliberations with their stakeholders, came up with variations to continue the march to achieving their vision. Today, we will have with us four organizations that are representative of that part of the sector that rose to the challenge and continued to deliver, actually, in some cases, even accelerated their impact during the continuing crisis. However, each story is different. In the case of a cushy baby, the org used its government partnership and tech platform to pivot to a COVID response strategy, while in the case of people, the org used similar government partnerships to pivot to a different target audience, although continuing with their original mission. In the case of Sukhibab, they continued to serve the same audience, but with slightly different content through a new tech delivery model. While in the case of Sarthi, while they started serving the same audience through a new tech model, the content remained exactly the same. From a format perspective, in the first half of the session, I'm going to invite each of the four speakers to talk to you about their stories, after which I'll have a couple of questions for each one of them. The second half of the session is focused on your questions for them, and I will ask the founders those on your behalf. That said, no need to hold on to the questions. Please feel free to post them on the chat in the first half too. With my hopefully brief introduction done, I'll start by inviting Ankit Arora, the founder of Sarthi Education, to share his story with you.
Hi, Akshay. Thanks. Thank you so much for the introduction, and thanks a lot for having us at this wonderful platform, the Skoll Forum. I'll try and keep the story a little brief and talk about the work that we do at our organization at Sarthi Education. So before I start, I just want to quickly start with the goal that we have at Sarthi. The one biggest goal at Sarthi that we have is that every child learns and progresses, not just learns, every child learns and progresses every day. And everything that we do at Sarthi, the kind of tech we adopt, the kind of model we go with, COVID, non-COVID, lockdown, non-lockdown, lockdown, whatever model that we pick up has to adhere to this single goal that every child will learn and progress every single day of their lives. And the way we have chosen to tackle this problem or achieve this goal is what you call in the for-profit world as the B2C approach, where we work directly with the mother and the children at their house by delivering them resources and the coaching right at their doorstep. Before I get into how we do it, I would just quickly want to acknowledge the reason why we chose the direct to the mother and the child and the B2C approach. One of the major reasons is that the school system in India is overburdened and overcrowded. Kruti, who's my colleague, who's gonna come here and speak about it in detail. But like anytime you come to India and like you look at this whole school system, you will realize that how difficult it is for the teacher to actually work on the academic task, because there are so many admin issues that the teacher has to kind of cater to. Also, if you look at the mothers, who do you think has the innate motivation, has this huge natural resource of resilience to work with their children day in and day out to make sure that they're learning each and every single day? Of course, it's the mother, and that's one of the major reasons we started to work with the mother and children at home. And it's not just me or my work of the last 3 years speaking, but if you look at a lot of resources, a lot of research that has happened over the last few years in the world, especially by Dr. Karen Mapp from Harvard, where she has come up with this meta-analysis of various research studies, which establishes a positive correlation between a mother's or a parent's involvement and a child's lifelong learning and achievement outcomes. Not just learning outcomes, but also the achievement outcomes. So with that in mind, we knew that this is something we have to crack in India. There is no good model which is working on the parent side, which can actually guide the mothers or the primary caregiver of the child to actually help achieve the child good learning scores at home and achieve our goal that every child is learning every day and progressing every day. How we do it is basically not a secret anymore. Like, if you pick up any parent involvement project across the world, across the last 5 decades, even if you start from the earliest one, which was started in Israel at the University of Jerusalem, there are two major components that you need to solve for when you're solving for the issue of getting the parents involved in the child's education. The first is, how can you provide the good quality resources to the child at their doorstep? Many a times, if you go to these households, go to the households in low income community, you see that children do not have access to good quality resources. The only access to resources they will have is their school textbooks from the government publishing agency or the private publisher if they're going to a private school. And that is not enough. That is completely not enough if you compare it to the amount of resources a child from a middle income or a high income household has access to. So the first problem to solve is fill the household with good quality resources, and not just good quality resources which will meet the child at their level. The second problem that you need to solve for when you're solving for an issue of parent involvement is that how do you improve the awareness and confidence of the mother? Capability in most of the cases is not an issue. Mothers are really smart, they're handling the entire household, they are motivated, but the problem is that they are not aware about the role they can play in their child's education, and also the amount of level of learning, the right parameters that a child should know. And the second is the confidence that they can actually contribute to their child's education, because over the last so many years they have been told again and again by the society, by the school, that you're good at rearing the child, you're good at nurturing the child, but not at educating the child. So you have to kind of break this mindset and tell the mother that you are, like, give them that confidence that you are capable and you are the one who's actually responsible and is actually someone who can achieve this goal of working with your child. At Sarthi, what we have done is, like, we have just tweaked this model a little bit. We have prepared these high quality resources by working with experts, by taking pedagogy followed by Khan Academy, Kumon, things to math. We have taken the pedagogy, created our own content, and the way we deliver it is via our mobile or web app. We also deliver it via a WhatsApp chatbot, and we also deliver it with via like a physical offline resources, depending upon the kind of access that the mother or the child have to at home. We also have this layer of what we call as relationship managers, which are basically women from within the community. Most of the time, these women are mothers who have graduated from our program. So these women are trained by Sarthi in using the technology in actually how to enroll your children and how to reach out to more children in the community. And these women then come together, enroll around 40 to 50 children under them, and take care of them for the entire year by providing them the right resources from time to time, and also by hand holding the mothers, by giving them the confidence that how can they actually navigate this entire Sarthi curriculum while staying at home and making sure that their children are learning. And the kind of results we are seeing have been very heartening, mostly thanks to the amount of hard work that the mothers are putting in, and also the amount of hard work that these relationship managers, which I was talking about, the field workers, are putting in and day out. Whether there's a lockdown or not, they make sure that they reach out to the mothers from time to time, whether on calls or messages, or even at times reaching out to their home at their doorstep and telling them that your child is sleeping and you need to work. What we have seen over the last 9 months now is that the response rates have been massively high, which is around 90 to 95% in terms of daily response rate, which is highest, one of the highest in the entire country, whether you look at non-profits or for-profit edtech organizations, which in other numbers would mean, for example, if this morning the Sarthi system sent out worksheets to around 8,000 children. So by evening, around 7,400 to 7,500 out of 8,000 are gonna respond back with their completed work to their respective relationship managers in the communities. So that's the high level of engagement that we're seeing, and not just that the engagement is high. We recently conducted a quasi experiment where we had like a few children in the treatment group and a few children in the control group. And what we observed that over a period of 4 months, the children who were receiving Sarthi's work grew by around 35.8%, around 36%, while comparing that to control group children, who did not receive any intervention from our side, who grew only by 8%. So there is almost a 4 times impact that we are observing in the children right now. And only because the mothers are kind of involved daily, and they are the ones who are working day in and day out, ensuring that their child is learning every day and progressing every day. And when every mother does that, we reach our goal that every child learns and progresses every day. So that's in brief what we are doing at Sarthi, and happy to answer any questions that you might have about the model or the last 1 year that we had.
Thanks, Ankit, for describing the criticality of parents, often ignored, of course, immortalized by the tiger mom concept. Uh, just when we hear about education in India, we usually hear about it from the macro point of view. Three-fourths of children are not learning, school consolidation is a problem, etc., etc. You've been a teacher in the TFI fellowship, and you worked with these children now for a fairly reasonable period of time. Based on your experience, can you tell me tell us actually what's the problem from a child's point of view? What is it in a classroom that's not working, and how's Sarthi trying to solve for that?
Right. I think that's a great question, and like as you rightly said, I have spent almost 2 years, a little bit more than 2 years, as a part of the Teach for India Fellowship, teaching children inside the classroom. And I think it's a great way to look at the problem as such, because mostly we forget about the user when we're designing the solution. It's good to think about a problem from a child's point of view. So if I had to point out at two major problems that a child faces in the classroom, is that number one, they are not learning at the right level and at the right pace. So every child starts at a different level, and every child has a different pace. For example, if I am coming from a household, I might have to help out my mother after my school with household chores. I'll have to help out my dad with the card that he puts out in the evening. So I might have a different pace of learning than someone else, and I might be at a different level. The problem inside a classroom is that the teachers today in India are not evaluated or not judged just on the fact that how much the child has achieved in terms of learning, but how much of the syllabus was covered in the entire year, whether you were able to complete a certain amount of curriculum or not. So what that leads to is that the teacher, after teaching say for 3 weeks of addition, she has to move on to subtraction. There's no other way she can continue to stay on addition. But for a child who might not be even aware of addition, they might have to start from way before their addition as well, and they might need more than 3 weeks even if they started at the right level. So the first problem is that you have to kind of change the pedagogy or change the entire structure to a way that the child should be able to learn at the right level and given the chance to grow and progress at the right pace. The second problem associated with this would be the problem of closing the feedback loop at a higher frequency. So what happens again in the Indian classrooms is that you are able to tell the child whether the child is progressing or the child has failed. You're able to deliver that news to the child or to the child's guardians or the primary caregivers at max at the end of 6 months, or in most of the cases at the end of the 1 year. So that's a huge injustice you're doing to the child by wasting their 6 months, by wasting their 1 year and telling them that your child did not grow, did not progress in the last 1 year, in the last 6 months. What you have to do is shorten that gap, be able to deliver that news to the parent or to the child right after 1 week or 1 month, or even lesser at every day, that you did not learn yesterday and we have to put in more focus on you, otherwise you might slip out. And that's the reason you see that how every year there is a huge amount of slip out which keeps on happening. More and more amount of children keep dropping out from the formal education system, and that's one of the bigger reasons, because we do not close that feedback loop on time. So that would be
Understood.
one of the major problems from a child point of view.
Correct. Thanks so much for that detailed answer. I do have a bunch more questions for you, and I can see that the audience has also started to put in some, especially on the online model. But we'll get to that in the second part of the session. That's what we have time for now. And now I'll just thank you and invite Kruti Barucha, the founder of People, to come and share her story.
Thank you, Akshay. It's wonderful to be here and to be part of this session and this amazing panel. So I'll tell you a little bit about our story, and before I get into that, just we'll share a little bit about the context. People is a nonprofit that works on education very deeply with government school systems in India, and as we have kind of evolved over the years, we've taken a bet with actually working and embedding deeply with the government school system, really to kind of strengthen the learning outcomes and quality of education that are provided in government school systems across the 29 states in India. Since this is an international audience, just a little bit of perspective on how big this problem is. There are 1.1 million government schools in the country, where 166 million children, many of them from the poorest families, study. The families often earn somewhere between $60 to $80 per month, so that's about 6,000 to 7,000 rupees per month. And so these are the government schools are really fee-free. They are located in communities. The government has largely solved the problem of access to schools. And the poorest of the poor are studying in the government school system. What the challenge really comes from the quality of learning. And a lot of data has shown us over the years that only around 50% of children who graduate from primary are able to actually meet the grade level competencies of a grade 2 child. And so there is a learning deficit, and that is really what people looks to work on. So it's really to kind of push the learning outcomes, the quality of education delivery in the government school system. The way in which we do this, I think for us, we thought kind of long and hard about what is really at the root cause of the problem and how do we actually kind of anchor a solution around it. We felt that the government has made huge strides in solving the problem of access to education for every child in India, in every state. Access has largely been solved by setting up schools that are in villages, within 1 to 3 kilometers of the child's house. Because of free midday meals in the schools, enrollment has also been relatively high. So children are able to come to school. They do attend because of the advantages of studying, the subsidies, the meals that are provided in the government school system. However, when we look at the classroom, the one place where we feel there's a gap and there has been there is space to kind of pay more attention is really in the teacher-student engagement. And so a lot of our work focuses on improving the quality of that teacher-student engagement in the classroom. And that is what we will ultimately translate into in terms of better learning outcomes and better quality of education and children who are able to graduate at grade level at the end of primary, middle, and secondary school. The way in which we tackle that problem of student engagement, there are 4 parts to what we do. The first is to actually set a bar for what excellence looks like. So really around the what do we want to aspire to for the government school system? The way in which we demonstrate that is through our exemplar schools, where we're actually showcasing what that high engagement pedagogy looks like. What does great classroom practice look like? What should every government classroom in the country aspire for? And how can we kind of raise the level of expectations in terms of education delivery? So the first piece of our work is really on the what should the new what should the quality of education be? What should that language be in terms of teaching and learning excellence? And then a lot of our work is focused on the how. And that comes to how do we work in deep partnership with state governments, with national government, to actually strengthen the overall government school system. The government school system, like I mentioned, is massive. So how do we actually drive this kind of quality improvement across a large state system? And the way, again, we look at the how is through teacher skilling and capacity building. The second way is through mentoring of academic officials at the principal level, at the district and block level, the individuals that are actually supposed to be providing academic support to teachers and schools. And then the third is really around incentives and accountability. So how can we actually shift the system to actually have a stronger focus on data, incentives, kind of performance management of the entire system towards better learning outcomes. I think at the end of the day, we'll just kind of leave with this thought. I think currently in terms of where a lot of the government school systems are across states, there is a lot of focus, as Ankit was also mentioning, on administrative duties. Teachers, government school principals, academic officials all get pulled into various administrative duties. I would say 70 to 80% of their time is actually spent on administrative duties, and that leaves only about 20 to 30% of their time on kind of the academic responsibilities that they have to deliver. So we really want to, through our work with governments and government systems, change that equation completely. We would like to see a government school system where all layers of the machinery are actually focused on academic improvement, academic responsibilities. So 70 to 80% of their time is on academic responsibilities and only 20 to 30% of their time on administrative responsibilities. So that is what we hope to make happen through our work and our deep partnership with school systems. Akshay, back to you.
Thanks, Kriti, for that interesting explanation, as well as the systemic approach that you've chosen to adopt to solve for the academic versus the teacher-child interaction challenge. You've scaled up, especially during COVID, your operations in a very, very short time. Can you just talk a little bit more about your approach towards partnering with the government system? Because you've got relationships with different governments, different parties in different states, and you've successfully managed that for a while. So, how do you forge those partnerships?
Yeah, absolutely. So I think pre-COVID, last year was actually kind of, I think, as we look back at last year, I think it will be one of the years in the journey of people that has, it was a year in which we kind of pivoted our approach and really scaled quite significantly and actually accelerated, as Akshay was saying, at a faster pace than we had previously planned for. So I would kind of look at our work as the pre-COVID phase and the post-COVID phase, because there was a tremendous amount of agility that the organization demonstrated last year. I think pre-COVID, we had operations in Delhi and Madhya Pradesh. We were running 3 exemplar schools catering directly to children. We had a direct-to-teacher development program, and then we were looking at a district transformation approach in Madhya Pradesh. All with the intention of kind of strengthening that school system capacity. As school closures happened, we could no longer operate in the same way, and we had to kind of shift our approach quite significantly. What did end up happening was, through strong discussions and kind of detailed conversations with the government, we realized that there was also a huge opportunity. Schools were closed, but if we were really thinking about long-term system strengthening and system improvement, we had a huge opportunity to actually work directly with teachers. And technology offered us a way to actually reach out to teachers in a way that we hadn't previously anticipated. And teachers were actually the last mile workforce to getting to students. And so we couldn't get to students because schools were closed, but we had the next best thing, which was actually to really arm the teacher workforce. And our expectation last year was, we anticipated early on that schools would potentially be closed for 3 months. We would really kind of work very closely and deeply with teachers, kind of really build out that teacher skill set so that when schools would open, they would be armed with kind of a refreshed set of skills that they could apply to improve classroom practice. In practice, the closures went on for much longer than we anticipated. but it gave us more time to actually work with both teachers, school leaders, and academic officials. So 1 year down the line, we've now kind of impacted from an initial plan of working in a district which would have about 3,000 schools. We actually ramped up and scaled across the entire state of Madhya Pradesh, across 100,000 schools and 300,000 teachers. We were able to innovate looking at a technology-based approach to teacher skilling. But we were also able to put in place a lot of measures to actually strengthen, build incentives and accountability of academic officials. And actually, just the way in which I think we were able to partner with the government on that, to your question, was really from the get-go, co-planning and co-designing what it would take to kind of make an intervention successful in this in the pandemic, and working with a kind of progressive government both in Delhi and Madhya Pradesh. Agility demonstrated on both sides, both on our end to be able to kind of shift away from what we had originally planned, build out new skill sets for the team, and then for the government to actually be very open to the ideas and actually kind of deploy their machinery to actually kind of make this program scale through their teacher training institutes, through their district level officials, so on and so forth. I think what's also very important in partnership or to kind of get to a successful scale program is really a strong set of communication protocols at the field. And I think that is, again, where we were able to leverage the government machinery to really drive those field level communications, so that we were not just kind of working top down, but a lot of the change was coming at the school level, the block level, the district level. So I think along with the work that we were doing in co-designing with the state government and senior officials across the different education departments in the state, also very focused on that communication layer, so that every individual within the hierarchy and the administrative machinery was able to get included in the program.
Sounds like an extremely comprehensive approach, and I'm sure people who've either had some experience or have worked with partners who've had some experience with working with the state or central government will probably have a bunch of questions for you. But that's what we have time for right now, and we'll of course get you back to answer the rest of the questions. For now, I'd like to invite Ruchit Nagar, the founder of Cushy Baby, onto stage to share his story.
Thank you, Akshay. So my name is Ruchit. I'm the CEO and co-founder of Cushy Baby. Cushy means happiness in Hindi. So we want happy and healthy babies. As you can imagine, we work in the field of maternal and child health. And what we do is we build digital health solutions for the Department of Public Health. Our work started back in 2014 when, out of a classroom project at Yale, we were trying to improve the way that infant immunizations were being tracked. And still today, most of those infant records are found on paper. Our solution was to provide community health workers with a mobile application, to provide parents with an automated voice call reminder system in the local dialect so that they would know when to come in and go to that village-based health camp to get their child vaccinated. And the third key component was something a little bit novel. It was to use a digital amulet like this that could store the medical history of that child in an offline, decentralized manner. So that way, when the parent would go to the health camp, the health worker would simply need to scan this near-field communication-enabled chip to see which vaccine was due, provide informed care, and then store the history on the medical record. This digital health solution was developed over the course of 2 years and then evaluated over the course of 2 more years in a rigorous randomized controlled trial. We followed 3,000 mothers from 600 villages over this period. We found that those mothers that were getting this digital health package, their children had a 12 percentage point higher full infant immunization rate. And with this evidence, we went to the Health Secretary of Rajasthan, which is India's largest state, to advocate for scale-up of this digital platform back in 2019. And he was open to innovation, but he certainly did test our team's ability agility, and ultimately gave us a graduated set of responsibilities so that way we could earn his trust. We were ultimately presented with the task of delivering the state with a digital health census of 80 million people, and then using that census to feed a longitudinal platform for tracking maternal and child health, which was our area of expertise. And we were in the midst of actually training our first batch of 500 community health workers in February of last year when the pandemic struck. And the government's attention also shifted to addressing this new and emerging public health concern. We were in a position where we had to make a tough call. Should we continue with our work? It was put on the side burner. The project was shelved. Or do we shift our attention to helping with COVID? And initially, we tried different things. We actually made the state's WhatsApp chatbot for addressing the public's concerns with COVID. But what we were able to do is we were able to lean into that mobile application that we had developed for the digital health census, adapt it, and make it into a tool for screening for COVID-19 within the community. And by adjusting the application, making it more user-friendly, shorter, and more focused, we were able to get the health department engaged and active and become part of that process. And we were also able to kind of leapfrog various different bureaucratic hurdles that would typically take place when you have the health department and the IT department trying to coordinate on something. So we got a mandate from the health department. We got government backend infrastructure support, and we were able to actually launch this through the government's state data center. And over the last 9 months, 60,000 community health workers, about 1/4 of whom were first-time smartphone users, we estimate, used our application to screen 14 million beneficiaries across the state. And just to give you a sense of perspective, in the previous 3 years, we had only tracked around 50,000 beneficiaries longitudinally. So in the past year, to get 14 million was a huge increase in scale for us. It was a learning opportunity for us to learn how to manage data and those number of users at that level of scale. It was an opportunity for us to actually integrate within the government's process, to understand a new model of implementation. So previously we had a very hands-on approach. We were working at a district level. At the state level, we had to learn how to do training of trainers, how to use Zoom, how to do remote monitoring. We literally joined hundreds of WhatsApp groups where the health worker teams were organized and communicating to help push relevant information and answer important queries. And even do advocacy at the state health official level to train them on how to use this data in an actionable way. I mean, we didn't want to lead to a situation where we had data overload. So ultimately, we started off with tracking child immunizations, and now the platform is even going to be used with the national platform for tracking COVID-19 vaccines. And certainly our digital health portfolio has grown. I think the key to our growth and continued sustainability is to really partner with the government, to really have that mandate in place, and not look to introduce something new, but to look to introduce something new within the context of the existing infrastructure and the existing systems that are in place. And we are very fortunate to have the government as a partner to allow us to deploy these digital health platforms to reach impact at scale.
Awesome. That is an amazing scale up from 50,000 to 14 million. But I'll take you slightly back to before the 50,000. After you got permission to change the system, what challenges did you experience in rolling out the digital health platform at scale? The first time on the government's backend infra, because did you face challenges on the ground? Did you face them within the IT side? Because yes, you've got a committed bureaucrat, but that's usually only a first step in India, right? Given how complex government systems are.
Yeah, so the first point that you noticed was the bureaucratic support. So the health secretary was an additional chief secretary. So already, at a very high post within all of the different departments, and was also very good friends with the IT secretary. So there was already a good working relationship the pandemic forced certain departments to put their guardrails a little bit down and collaborate more effectively. So that was also a conducive environment. But yes, there were challenges. We had not worked at this level of scale when it came to managing a technology platform. It's not like Amazon where you can just click and deploy your servers. You have to physically go on site and install a lot of code. There's a lot of permissions still involved. We still have to get audited and go through all the different procedures. But what a process that might have taken 6 months to a year, we were able to get done in about 2 months' time, which is still quite commendable for the government and all the safeguards that it needs to follow. I think it was very interesting going through the implementation process as well, because we had never done a training at scale. So in this case, we were not directly training our end users who are these ashas from the village level. We are training the 2 supervisors up, the medical officers at the primary health center level, and the quality of the ultimate work was dependent on the last link of that chain. So we did our best effort to look at different ways to circulate information, whether it was videos, training guides, to set up a help desk, not 24/7, but you can say a 12-hour-a-day help desk to field any kinds of queries, and really be proactive. So once the lockdown restrictions did release, we traveled to around 12 or 13 districts by car, meeting with the chief medical officers of each district, sensitizing them to the importance of the work. And it actually turned out to be healthy competition, because the daily reports that we would send showing the different districts that had done different numbers of surveys, it became a friendly competition that people were sharing those rankings in their own local WhatsApp groups, trying to improve their number of screenings as well. So that was also a kind of unexpected but friendly outcome for us that helped in our favor.
That's interesting. Competition within the government to push out, similar to the way that number of vaccinations done, in a similar manner, how many people were covered. That's
I mean, the important caveat is, of course, the data quality. So later on, we added in different ranking metrics for data quality and the percentage of vulnerable people that you're actually surveying out of your total, which was really the target. We weren't supposed to be surveying everybody in that effort. But yes, I think that's really kind of the crux of the issue is, is the ASHA worker actually going and doing the survey in person, which is what we want at least once on the initial registration, or is she doing it remotely? And what we need to get to is a way to quantify that. We need to get to a better sense of the data quality score, the data quality profile of each community health worker, so that way over time we can incentivize them to do more in-person follow-ups as is required.
Okay, perfect. No, that I again suspect, given the level of infant mortality in the country, the challenges with mother's health, there will be a ton of questions for you from the participants. But for the moment, that's what we have the time for. So thank you so much. And I'd like to invite Dilip Pachwala, the founder of Sukhibab, to share his story with us.
Thank you, Akshay. Thank you so much for this opportunity. We at Sukhibab are working towards destigmatizing menstrual and sexual reproductive health in marginalized communities across India. Giving a bit of the context to the problem we are trying to solve, there are about 200 plus million women in India facing significant stigma while not having either awareness or access to healthy menstrual practices, which directly impacts their quality of life, including participation in school, workforce, and social life. We, Sukhibab, started in 2014, and we started as a sanitary pad distributor through local women entrepreneurs. And we were running the distribution channel for about 6 to 8 months, only to realize that at the end of it, that the women who were buying sanitary napkins from us were the women who were already using sanitary napkins, and the women who were not using sanitary napkins were still not using sanitary napkins. And that's when we realized that education is important, and then we got into mass education campaigns. And we did that for a few more months, only to realize that majority of the content is not being remembered by the women in these rallies, because this is a subject which they don't talk about within their own households. That now that we bring them into like mass education campaigns, they their immediate response is to shut down and not really like engage with the conversation. And we're delivering a lot of content. And that's when we slowly pivoted over the years to understand that behavioral change is the core and the root of the problem. And unless we're able to like end stigma around menstruation, we will not be able to solve this problem sustainably. We at Sukhibab now believe that if you're able to talk about menstruation like a normal bodily process, there will be an organic increase in demand for information, product, health, rights, etc. So how do we make people talk about menstruation like a normal bodily process is our work all about. We have been doing this behavioral change work since 2016, where we work with women, girls, men, boys together in small groups and engage them in multiple conversations to create safe spaces and enable dialogue around menstruation. What we typically see when we work on the ground is when we bring the women together for the first time, there's a lot of giggles and hesitation, and they don't want to engage in a subject like this. The second time we meet them, they acknowledge our presence. The third time we meet them, they smile at us. Fourth time we meet them, they have a question probably about their menstrual health and sexual reproductive health. This has been a trajectory of behavior change that we have seen consistently in the work we do. Once we arrived at this convincing model, the big next question was like, even if we continue cut, copy, paste this model for the next 1,000 years, probably will not reach all the women in India. So how do we scale was the question. And also acknowledging the fact that India is a massive country and a Sukhibab alone will not be able to solve this problem. That is how we conceptualized two programs, the Period Fellowship Program and the Periodpreneurship Program, where we use this program to scale our work while also build capacity of the ecosystem through menstrual health leaders and organizations. Through these models, cumulatively, we have reached about 160,000 plus people, had reached 160,000 plus people by March 2020. And we are all set to roll out a 5-year strategy where our goal was to reach 1 million people through this 5-year strategy. And that's when COVID happened. And the core of our work, which was behavior change and mobilization of people, was put to a question mark. And we realized that we will not be able to do any part of those programs or implement any part of those programs anytime soon. With one of the strictest lockdowns in the world, we realized that even the menstrual health practices were getting deteriorated. Women were going back in time to the practices that were being followed. Like simple things like not having access to toilets, not having access to water, and women not being able to go to hospitals when they have a sexual reproductive health condition had a massive impact. And we saw a steep increase in the number of infections, unwanted pregnancies, unhealthy abortions in the communities that we are working with. One of the UNICEF studies says that with every 3 months of lockdown, there have been additional 2 million sexual reproductive health conditions. So cumulatively, we're now expecting about 10 million sexual reproductive health conditions that have to be resolved. That's when we realized that we can't sit back and wait for COVID, and there was a lot of stake, and we had to like figure out a means to like continue working with the women and continue to work towards our vision of making menstruation a non-issue. That's when we launched a 21-day challenge within the organization, where we made the phone numbers of our frontline workers as helpline numbers and promoted them within the communities to understand if women are calling in, and if they're calling in, what are they calling for. Within a 1-week period, we got hundreds of calls. Out of them, half of them were around menstrual health and sexual reproductive health. That's when we realized the mobility restrictions with the lockdown coming in had a massive impact around the sexual reproductive health conditions of these women. But as soon as we validated the need for information and access to healthcare as critical needs of the hour, that's when we started working towards building our helpline. And 30 days from that point, we had built a helpline wherein any woman or girl from across the country can give a missed call to our helpline, and they'll be able to access either information on menstrual health or sexual reproductive health, or talk to an emergency helpline assistant, or even talk to a gynecologist and seek consultation whenever they need. It has been a roller coaster journey since we started this, but we're happy to say that over the last 7 months of running the helpline, we have reached about 75,000 plus women and girls, and we are all set to reach about 500,000 people in the next 18 months. I'll stop there and see if you have any questions.
Awesome. Thanks, Dilip. It's an interesting transition, of course, as we've seen from being a grassroots organization to being a tech platform. What was the process between there? What did you go through to make this transition?
Yeah, it was a very difficult transition, I must say, Akshay, because we had built a capacity to scale our grassroots program through a 5-year strategy. So the capacity and skills and the mindsets that were cultivated were focused on the grassroots work, right? So moving to an entirely technology platform was quite a bit of work, and it required immense agility from the team to make it happen. But the three-fourths areas of work that we consciously invested in was one, people. We were sure that we did not want to like let go of anyone in the organization because one, like we value people, and two, there was a lot of capacity that we had already built in them that we felt was very resourceful to the work that we are doing. So we restructured the organization entirely, where we made our frontline workers who have been working with us over the years to become helpline assistants. We restructured the teams from operations team to tech teams, from partnerships team to outreach teams, etc., where like we had to like go through an entire re-engineering of the organization for it to happen. And the second is the capacity. And I think one of the early realizations we had was that if we are going through this transition, we have to like consciously invest in capacity building of the teams for us to be able to like adapt into tech environment. And the last piece was, which interestingly also happened, was as we built the helpline and launched, we also realized that there was a lot of increasing demand that was coming our way. Like we have had the highest number of donors who we have collaborated with in the last 1 year, higher number of grassroots organizations who collaborated with last year. So being able to like hold on to these challenges of not letting go people, building capacity, building an entire platform, at the same time ensuring that we're able to like actually deliver has been a super interesting challenge. But one thing that really worked for us was the culture of the organization being in the right place really helped people realize that we are together in this and we are collectively working towards the vision of the organization, and having a team of high ownership individuals has really helped us sail the boat.
Awesome. So, one of the things that you said was about how you actually had more partners, more donors that you worked with last year. And it could potentially be in sync with the technology shift, because typically the movement to technology enables scale, right? But traditionally, of course, depth and breadth of impact are usually inversely proportional. So, just wanted to understand, how has your perspective of impact evolved with this change in your model?
Absolutely, Akshay. Considering we were a holistic grassroots intervention before COVID, it has been a challenge for us to like comprehend the quality of impact that the tech platform like this would entail, and how comfortable we are from moving from a high touch solution to a light touch solution. But it has been a very pleasant journey, just realizing a bunch of things through the process. Like a couple of things are, one is like we realized that one, we're able to like reach out to target groups who we struggle to reach otherwise in the pre-COVID era. Like for example, we're talking about sex workers, LGBT community, differently abled people. This was very incidental. This was not designed for, but we suddenly saw that people were reaching out to us seeking for information and sexual reproductive health, healthcare, and then we realized that these are the target groups who, even in a non-COVID scenario, struggle to access information and access to healthcare in general. And the second is we realized that there's been a ton of momentum around the menstrual health ecosystem in India over the last decade, right? There were so many organizations who have started focusing on awareness and behavior change, but most of them had to pause their work with COVID coming into picture. Then they started reaching out to us saying that, hey, like we want to hold on to the momentum. Can we take your helpline to the regions that we are working with? And other interesting observation also was that there were organizations who were not focusing on menstrual health at all. Like there could be livelihoods or focusing on financial inclusion, or community-based organizations in most parts of India. They saw the value in actually taking this helpline because they realized that COVID has had a massive impact on the health of women in their own communities. And the last piece is that as a whole, with all of these, we realized that like although there was a bias against a light touch solution when we started off, we realized that we were able to like fill in some significant gaps in the ecosystem that were emerging with the COVID constraints coming into picture, or the target groups who were not addressed earlier, we were able to address them through our intervention.
Awesome. All right, I do have a follow-up question, but let me first invite everyone back on stage so that we can, I can throw the questions I had for them also at them. So just continuing with you, Dilip, so you've had some learnings from this. But how do you see this playing out in a post-COVID world? Will you be back to the offline model? Will you pursue the online model? Will there be a hybrid solution? How are you thinking about it? And I know that given that we seem to be going into a second series of lockdowns as the new wave emerges in India, we might be some distance away, but have you spent some time thinking about that?
Yes, absolutely, Akshay. As we started building the tech platform, like the helpline that we are building, one of the things that we have been cognizant of is because we are investing a whole lot of time, mind space, energy, resources into building this helpline, we want to make sure that this contributes to we being able to do better work in the post-COVID world. So the helpline is being built in such a way that we can use the helpline as an entry point as well as an exit point in the community behavioral change work that we might do in the post-COVID world, where what we realized over the last 7 months by reaching out to like these 50,000 plus people is that they have built some rich data around what are the patterns of sexual reproductive health concerns in these communities that we are working with and what are their concerns. And that data is going to really help us contextualize our behavioral change work on the ground. And second piece is earlier when we were driving a behavioral change work, like I said earlier, it's only by the fourth engagement with our participants, we see women opening up and starting to talk about sexual reproductive health concerns, and that's when our intervention would end. And we would not have the bandwidth to go back and engage in a conversation with them. So now what we see happening is they connected to our helpline and they being able to like continue the conversation and we being able to get in touch with them through our reinforcement messages so that the behaviors are sustained and the conversation continues.
So it becomes a supplemental to what you were doing earlier, enabling you to potentially have continued deeper impact. Got it. That is interesting. Okay, coming back to you, Ankit, I did tell you that I had a few for you. Just, again, questions similar to what I asked Dilip, because both of you have shifted to tech-based models. You know, there is the challenge that the digital medium is usually unable to replace what is inside a classroom, and potentially there is also some level of usually lack of access in low-income communities. So did the transition from offline to an online model create a challenge for you in terms of, did you lose a step? Which that's the easiest way I can figure it out. Did you lose a step in transitioning?
Right. I think rather than saying lose a step, we actually might have gained a step. And the reason for that is I understand when we say that technology might not ever replace what happens inside a classroom or how the child practices, but actually that's the wrong way of looking at it, because that's something we are not even looking at replacing. I'm not trying to replace how a child learns or how the child is going to practice. If they want to practice on a pen and paper format, so be it. If they want to practice when their mother is sitting right next to them, or if she's in the other room, it's up to them. The reason I think why we kind of gained a step, if I might say so, is because so as you asked me in the previous batch of the discussion that what is one of the problems according from a child's point of view. So that the problem of closing that feedback loop at end of the day was not possible in our previous model. We had to wait for almost a month to know whether the child had completed that set of activity or not from the mother. It was because only when my relationship manager in the field would go to the house, talk to the mother, collect that data, okay, show me the activity kit that you got last month, how much you have done, how much you have not done. She would report it back to me, and by that time my content team would reach out back to the mother saying, hey, you did not do your work, or hey, you did your work but actually it was incorrect. 45 days have already passed away. And like after 45 days, it's actually useless to go back to that particular content and say, hey, your child has not been learning anything for the last 45 days. And I think that's what we were able to plug in through the use of technology, which is now what happens is at end of every day at 8 p.m. in the night, we are able to know whether a child had done the work or not. And if they had done it, whether it was correct or not. And what my field team is also able to do, according to the tech interface that they have, is send out like very quick messages to the mother that, hey, you did not work today, or hey, your child could not progress today, but let's try again tomorrow. And what happens on a meta level is that we are able to figure out these at-risk children, if I might call them, at-risk children who are not responding to me for the last 3 days, or who are responding but are actually not able to progress in the curriculum ladder. So we are able to identify these at-risk children within the week and reach out to them. Even a week is late, but at least it's smaller than 45 days. So I'm able to figure out, okay, these are the 100 children out of the 5,000 children who could not read, who could not learn the last week, and these are my priority children this week. So this week, all the relationship managers would have like a priority list with them, in which these 2-3 children each on every field worker would be their priority. So they know that, okay, before they fall out of the system, I have to catch them. And that's the reason we are seeing less than around 1.5% dropout month on month over the last entire year, entire 12 months.
That's interesting. So basically, to borrow a line from the Marines, it's actually enabling you to ensure no child left behind.
Yeah, right.
Which
I think we should just
so,
take that as Sarthi's tagline.
Perfect. Happy to contribute that. Okay, so question to you actually, this time, Kruti, shifting gears from parents to teachers. You've been running a program in SDMC, the South Delhi Municipal Corporation, on teacher training before COVID, which was very intensive. It involved direct engagement with the teachers, and during COVID, the MP model that you launched, that you've gone to 300,000 teachers with now, is fully digital. So, what was the transference of learning across the programs as you pivoted? And also, addendum to that is what has come out of the NP program that you might actually be able to use in the Delhi program as, again, we open up whenever that does happen.
Yeah, no, absolutely. So I think, before COVID, I mean, the work with Delhi in the South Delhi Municipal Corporation was with around 500 teachers across about 150 schools. And it was very, direct to teacher. There were interactive bite-sized sessions spread over the course of the year, classroom observations, feedback provided, coaching, mentoring. And we just found we couldn't do that anymore once schools closed. Because we had actually been able to pilot and rapidly scale this digital teacher training approach in Madhya Pradesh. I mean, it was so timely for us because our program in Delhi took on a similar kind of acceleration in terms of being able to use a lot of the material and learnings from Madhya Pradesh. So we used a technology platform, we codified what good teacher training, what a training art could look like for a teacher. So we didn't want to just send, a 30-minute video or a 60-minute video, because we just felt that wouldn't necessarily stick or have lasting impact. So we created a training arc for every single course that we created. There was a pre-work, there was a main course, and then there was post-work. And that formula, or that training arc, was something that we could apply in our work in Delhi as well with our teachers. Also, because we use technology to essentially reach all teachers in Madhya Pradesh, and we use the national technology platform Diksha, all of these became assets. These were assets which could scale and be taken across states. So we found that we were doing this in Madhya Pradesh at the state level, but these were actually assets that any teacher in India could actually access. So we took a lot of the, we took some select modules that we felt were relevant for the Delhi context, and used them with our teachers, because we couldn't do in-person trainings anymore. So again, we had to kind of shift that behavior. We did spend some time in actually orienting teachers to this new platform, to helping them kind of absorb that content, making sure that there was a little bit of hand-holding done to actually introduce the program to them. But the beautiful thing about this was that we could actually kind of immediately scale and replicate that model in Delhi. I think when we thought about post-work, we were able to actually take learnings from Delhi that we had done through that intensive program, take them to Madhya Pradesh, because we knew how teachers would kind of respond, what type of post-course submissions they could do, how we could actually evaluate and assess them. We had done a lot of that work in our live model, and we could actually kind of structure that to think about what that might look like in terms of post-work submissions, assessments, when we tried to look at sticking that content that we were delivering as training. So SDMC actually brought about a lot of, was able to give us a lot of learnings for, making sure the content was sticky in Madhya Pradesh. And in Madhya Pradesh, I think the interventions that we just had to put in place because it was all digital were things that we continued to shift in Delhi. So a lot of our in-person discussion forums or discussion groups became digital professional learning communities. We used kind of design principles that were relevant across the two geographies. We found that the content was actually, because it was an asset created on this platform that was available to all, it was kind of open source. We found teachers in Rajasthan, Haryana, Uttar Pradesh actually accessing this content. So we found about 75,000 teachers outside of Madhya Pradesh and Delhi were actually also looking at and reviewing the content. So there were learnings on both sides actually across programs. And I think that has helped us actually think about, how do we actually codify a lot of our work and use technology to actually create resources that can scale quickly across states, because many times the context of the government teacher having to teach a multi-grade classroom with challenges and constraints is a similar challenge regardless of which state you go to. And so how do we kind of apply certain design principles and codify our work so that we can actually kind of take it to different geographies?
Amazing. Thanks, Kriti, for that detailed answer. Rich, it's coming to you because you're anyways the man of the moment, right? Everyone's focused on health at this moment across the world. How do you think the pandemic is going to change the deployment of digital health in India? There are tons of things around just from the government right now, right? There's Arogya Setu, there's COVID. They both reach new levels of scale, but have significant, limitations, which media has also been speaking about. There is a UPI for health that NHTM is trying to bring out. The government is trying to push free telemedicine through eSanjeevani. What do you think is, in your opinion, the next breakthrough, which actually really affects the bottom of the pyramid in India? And of course, we've got a large bottom of the pyramid.
Yeah, it's a great question. And I think that the current paradigm is to find a way to connect with the beneficiary directly and collect health information from the beneficiary directly. And that's what you saw with Arogya Setu. They reached 150, 160 million users. But the problem that remains is that we are only really getting that top of the pyramid. 160 million out of 1.3 billion means that you still have a considerable amount of gap to cover. So I think that the paradigm really needs to be thinking about the fact that India is still 70% rural. There are still internet gaps when you get into rural areas. And instead of trying to push technologies that might be better suited for tier 1, tier 2 cities, rather think about the community health workers that are living in these communities. How can we empower them? Many of them now are becoming first-time smartphone users. And many of them still are burdened by outdated paper-based methods of tracking, whether it's ASHAs having to do multiple surveys for multiple different health vertical programs, writing the same beneficiary's name in multiple registers, waiting for a data entry operator to type that into a system so that they can get their monthly salary and incentive. I think we have the technology now, and the digital literacy is starting to pick up, that we don't need to to rely on these old systems. And digital proliferation is certainly coming. So this is really a moment for us to empower community health workers, which is, I think, the first point. The second point is that we are going to start getting a deluge of information. And you saw this with Arogya Setu, which was used in a way to try to do digital contact tracing. CoWIN also now trying to track every vaccine dose that's being given in India. Both of them clearly have gaps. You're not going to get everything. But it's very important to understand what is that baseline denominator and how accountable, how reliable is the data that we're collecting. And once we do collect that data, how do we even process it and make sense of it? So these are some of the harder questions that I think should be prioritized before some of the more flashier headlines that talk about a rapid expansion of certain digital health platforms. But yes, we are moving in that direction. Telemedicine is something that you could see becoming an option for many more people in the coming years. But I think really the starting point is, how do we digitally enable these community health workers? How do we hold them accountable? How do we make their work more effective? How do we automate things that they should not be spending time on, so that way they can spend more time providing care? And then using that data, using that data in two ways. How do we train state health officials to look at GIS dashboards and make real-time, locally specific decisions in a way that is intuitive to them? And two, how do we connect this, a big stream of data to automated systems, whether that's automated communication platforms that are dialect specific, so that way the data feeds back to the beneficiaries at the end.
Got it. We're going back to we own our data concept, which is being hotly debated across the world. Of course, in India, we still have some distance to go on the privacy regulations, but that'd be a good step. All right, Ankit, a question from the audience for you, from Varun. Can you shed some light about how you control the quality of education that mothers are providing to their children? And is it quantified solely through traditional evaluation methods like exams?
I mean, like, I don't know if I completely get the question correctly, and I can read it as well. By conventional exams, if you mean like standardized exams, then no, but we do conduct our own assessments because the assessments conducted by schools are very sparse and also not standardized. Like children go, some of the children are actually not going to the school, some of them are going to a government school, and some of them are going to different private schools, some of them are in Anganwadi. So it's difficult. So we have our own standardized tests, if we can call them, and that's something which we conduct to know whether the child is learning on a daily level or not. Second, how we control the quality is by looking at the child's responses, which we receive by end of the day, which are evaluated by the field managers. And also we are building some kind of technology, which is more like handwriting recognition, voice recognition. This tells us that whether the child is attempting the questions correctly or whether the child is speaking correctly in case of a language exercise. Also, I think a lot of the things depend on the kind of content pedagogy that we have chosen. So the thing that we have chosen is called incremental advancement theory, which has its history in Japan in the early 1940s, 1950s, when this high school professor called Toru Kumon came up with this entire Kumon philosophy, which I'm sure a lot of us are aware of. If not, we can quickly Google, and it's a great way to learn arithmetic and language based on the pattern recognition capability of humans. And it's also kind of complemented by what we learned from Khan Academy and Thinkster Math, who are using the same pedagogy. So our content, Sarthi's content, is also developed in a similar fashion, which kind of builds on the pattern recognition ability of the children to learn the consequent topics, and which basically helps you to control that quality of the education which mothers are delivering. But I think I might have answered in the first part of my answer, which is that so like the kind of test that we conduct and the kind of technology that we have tells us whether the child is learning or not, because at the end of the day we really want whether the child has mastered that skill or not, and the way to understand that is whether a child is able to perform on a pen and paper format or not.
Okay, thanks, Ankit. Varun, I hope the question's been answered. If not completely, do feel free to post a supplementary on chat and we'll get Ankit to address that. Um, Kruti, one for you from the audience, from Jay. Could you touch upon how effective the SMC committees are that government schools have? Ankit, I'll also bring you in later to answer the same question, given some of your experience also with SMCs in schools.
Right.
Kruti,
Yeah, sure.
yeah.
So every government school is required to have a school management committee. Many times the SMC is in place, and I think several schools have and government school principals have done a very good job of kind of constituting the SMC. Some schools also have set up kind of student parliaments, and especially in Madhya Pradesh, I've seen that in many rural schools as well. And those are great initiatives that have been taken up by principals as well as by the state government education department. I think what probably where there's probably some space for improvement is actually the engagement of that SMC on decisions around resource allocation, around how the children are learning, around the assessments, around the school quality. I think what now that the committees have been set up, I think the conversation needs to shift to what is the regularity in terms of how frequently are the committees meeting, what are the kinds of decisions that are made during the SMC meetings, what is the interaction between the principal and the SMC members, how seriously is their feedback taken. So those are all, I think, the where the conversation should be now. I think it's a great structure for greater engagement of parents and community members, and for the school to actually now then become a place where which is very porous in terms of interaction of the teacher, student, principal, parent, member of the community. I think everybody then starts getting very involved with the quality of education delivery in that village, in that community, in that district.
Awesome. Thanks, Kruti. Ankit, you want to come in and speak about the experience from the parent side? Kruti spoke about it from the school side. So, given
Right.
your B2C model, you want to bring in the other side of that experience?
We some of our parents definitely are part of SMCs, and we haven't seen many positive responses from their side. And I think my hypothesis, at least in my opinion, is that for any committee to work anywhere in the world, for that matter, has to have some kind of autonomy, whether it's financial autonomy or structural autonomy. But what happens here is I don't think because I think the SMCs do get some kind of a fund. It's called the School Development Fund. Kruti, correct me if I'm wrong. So SMCs in India are allotted some kind of school development fund which they can spend, and I think as soon as that gets involved, there are a lot of other members who make sure that the right kind of parents are selected for the SMC, so that they can use the funds in which they want. So many a times deserving parents, many a times the rule says there should be elections for SMCs, and there are many organizations that are actually working to ensure that elections do hold place, but in most of the cases they don't. So that's why we haven't seen a lot of parents being very positive about the entire SMC experience, and of those who have had positive experiences are mostly limited to the administrative part of the school. For example, time should be extended by 15 minutes, or you should install a heavier gate so that there is more security. There has been very, very less amount of involvement if you look from an academic perspective. And since at Sarthi we don't say ourselves to be a holistic education provider, we only focus on academic part. So that's why we haven't seen much of a positive academic involvement from the SMCs, from the parent side of view at least.
Got it. Thanks. That's a different perspective, and it's good to have different perspectives. Kruti did speak about those limitations, but yeah, basically the point is that it was a step in the right direction, which both of you said. But the School Development Fund, which is supposed to give autonomy, has actually brought in conflicts of interest and potentially created a little bit of a messy implementation in the system. Yeah, talk about unintended consequences, right?
Akshay, if I could just
Okay.
add one thing.
Of course.
I think it's a great question, actually, and Ankit, maybe you and I should chat about this. It's a great unintended consequence of the panel discussion.
Right.
I actually think that it's a great instrument to use. So sometimes, some of our work is around, as you strengthen school systems. I mean, I was talking about how one piece of our work is around incentives and accountability. And oftentimes people think about incentives and accountability very much as top-down, right? Because when the focus is around improving the quality of education in the system or in the school, the burden often falls on the teacher, and people are hard on the teacher and they say, well, the teacher's not putting in enough effort, they're not spending enough time in the classroom. The teacher, meanwhile, is burdened with a lot of administrative responsibilities as well, and perhaps not enough support from the system to be able to actually learn how to become a better teacher. It doesn't come naturally to everybody. You actually, over time and coaching and mentoring, you actually become a better professional. So, I mean, the idea of an SMC is actually quite powerful in terms of the kind of grassroots or the bottom up incentives and accountability that we can start creating and using within the system. Because ultimately, having parents, community members who are actually working very closely with the school on achievement in learning outcomes, asking questions about how is my child doing. There's already kind of an accountability that starts developing. Currently, it's also a very hierarchical system right now between the school principal and the parent, where the principal and the teacher actually feels that they are the ones to decide how the child is doing, whether they're capable, not capable, what is their potential. And the parent has very little agency. So I think the SMC is a great instrument and a tool that we should use. I think maybe the onus is on us to actually develop a case study of what effective SMC engagement needs to look like. And if we can maybe show that in one district or in one cluster, it has potential to replicate, because that's, I think, where the gap is. We don't have enough structure around what is the SMC supposed to do, how do they get together, what should they discuss, what's the outcome of that, how do you track that? Just thought I'll add that, Akshay.
No, that's perfect. It is, again, as both of you said, it is a tool that was a step in the right direction, right? And there are reasons that it's not really worked, and some of the reasons are the ones that you've enumerated. Apart from the conflict of interest part that Ankit brought in on the school development fund part. No, that's perfect. And yes, you guys should definitely catch up on this. I would love to see a case study come out of this. There is a question for you from the audience. How would you tackle educating youth about other taboo topics in South Asia? Even diasporic communities are facing this issue as the culture is basically ingrained with this mindset.
Yeah, that's a good question. Like I said, with Sukhibab, we have constantly evolved to understand how do we really end stigma around menstruation or enable conversations around menstruation. And I think some of our insights and best practices are quite relevant and applicable to the other taboo topics for young people in the country or in South Asia as well. So I think if I have to oversimplify this, I think the basic answer is if you're able to really create safe spaces, either virtually or in person, and make people talk about a subject like this in a more comfortable, safe manner, I think that's where the conversation starts. And the second piece is instilling a sense of critical thinking. And I think that's the core of the work that we do at Sukhibab as well, that a subject is a taboo because it is like a Chinese whisper, right? It has been passed on from generation to generation, and it is termed as a taboo. And that's how we've been told by our own families or societies that it's a taboo topic and we're not supposed to talk about sex, we're not supposed to talk about menstruation, we're not, etc., etc. So as soon as we start dissecting it and start building a sense of critical thinking around why we do what we do, why we think a certain way about certain things. And I think that's where the conversation starts in unraveling or unfolding stigma around these subjects. So there's definitely a great sense of overlap between and tackling stigma around menstruation, as well as a lot of periphery subjects around gender and sexuality as well.
Perfect. Thanks, Philip. Again, to the audience, in case you believe your questions not necessarily been fully answered, or you have, another supplementary to it, please do post it on chat, and we'll be happy to get the founders to address that. Ruchit, the next one's for you. There's enough evidence now that demonstrates that ASHA workers are overworked, right? With obligations under various schemes. When attempting to create the right incentives for the community health workers, how do we address this reality, say at Cushy Baby? Or if you'd like to answer slightly broader based on your experience with the other orgs working in the sector or the other issues that ASHA workers have, how do you align their incentives and objectives correctly?
So India has over 1 million ASHA workers. They are the largest community health workforce in the world. They're incredibly important, locally elected women that provide counseling, provide motivation, and basically ensure health and education is delivered to vulnerable groups of people within the community. You're absolutely right. They are overworked. They are underpaid, underappreciated, I would say. So I would advocate for higher pay and having a stable salary from a single department. Certain states do it where multiple departments are paying part fixed, part incentive based. But making sure they are well compensated is one. Number two is giving them the right tools. I think now many of the younger ASHAs are getting their hands on phones, feature phones, some smartphones. I think it's a great opportunity in this day and age to allow them to become digitally empowered and facilitate that process. And the government can take a role to step up in providing the monetary incentives in order to get those tools in order to succeed in their work. And it's not just a gateway into the digital world, but it's a gateway into making their world more efficient and effective. ASHA workers can spend up to 20 hours a month doing manual tabulations, traveling to the nearby primary health center, waiting for the data entry operator to type in their work. And they should really be spending time providing care, counseling mothers, calling mothers up, and checking in to see how they're doing. And doing so, not only on the basis of their intuition, which of course may be having certain blind spots, but doing so with the help of of basically guidance in their pocket, a data-driven approach that can help them be cued into certain areas where high-risk conditions may be emerging. So, I think when it does come to incentives, I think unfortunately the health system is structured in a way where we are looking at things like outputs, we're looking at outcomes, and we're not adding that layer of supervision. So the easiest way to create those outcomes is to report that the desired outcomes are happening. And without supervision, that means that there's a disconnect between the data that ultimately percolates up to the central government and the grassroots reality. Only an estimated 50% of maternal and child deaths are actually reported, for example. Many states that are reporting immunization rates of infants are reporting immunization rates above 100%, which tells you that we don't have a correct baseline denominator. So there is also an accountability, a skill gap that needs to be addressed. I think really the incentive structures should be tailored in a way that provides supportive supervision, that provided a graduated set of responsibilities, that look at the overall data quality and work performance. And all of these things that I just mentioned, whether that's delivering care with decision support, monitoring data quality, improving doing a continuous education type of tool, all of those can be bundled in a smartphone application. So really what we are trying to do at Cushy Baby is to make an integrated, unified interface for these ASHA workers that doesn't just cater to COVID-19 or reproductive and child health, but really does address the spectrum of different health verticals that they need to work in, and also connects that data to the respective stakeholders that they are in touch with, whether that's the nurse, the auxiliary nurse midwife, or the medical officer that's sitting at the primary health center. Their data should be shared and moving freely.
Got it. So the future is digital and the future is now. That's the message I'm taking home from that one. Uh, Perfect. All right. Question to you both, uh, both Ankit as well as Kriti on education. Uh, you know, how do you think education? So I asked Richard this already for health a little. How do you think education as a sector is going to change after the pandemic? We go back fully offline. Will there be components left? Once things, let's say, go to whatever is considered the new normal. So, Ankit, you want to take that first, and then Kriti can come in.
Sure. I think it's quite interesting and too early to say that how the entire sector is gonna change, especially as we are again peaking in terms of the number of cases. I think a few early trends that we are trying to see is that parents are becoming slowly are becoming a major part of the educational journey of the child, and this is happening across all the socioeconomic classes, in the just not in the like your middle or high income economic classes, which happened earlier. So I think parents are gonna become a more important stakeholder. Secondly, I think the role of school is going to be redefined a little bit again, because parents have now realized again across the socioeconomic classes that learning is happening at home. Learning has to happen at a child's pace, at a child's level, and that can be delivered only at home. Actually, you cannot deliver that amount of pace, that amount of uh, personalization in a group setting of 40 to 50 children inside one classroom. But there are a lot of things which actually can only happen in that setup of 40 to 50 children inside one classroom, whether it's social emotional learning or peer learning or making those bonds. So I think the role of a school is going to redefine, and that's what parents are also going to realize. Okay, this is what I get from school, and this is what has to happen at home. And I think for good, what's going to happen is that, so today we heard that the Central Board for Secondary Education cancelled the standardized test for grade 10th children. So I think this is again going to push people in thinking that what's the importance of these standardized tests across economic classes, whether it's going to impact one economic class more than the other. And if not, then how do we actually take these examinations? Are these just the filters of telling us whether a child knows something or doesn't? Then if that's the purpose of examination, then it's failing at it basically, because then examination needs to tell you that where you are lacking so that you can improve on that part. Whereas in India, what happens is it kind of tags you that if you got 70% marks in class 10th, you are a 70%er for life. If I got like a 90, I'm a 90er for life. So that tagging is actually not good. Apart from the top 10, apart from the people who get more than 90%, for the rest of them, it's more like a demotivator factor. So I think that's also going to change, where people are now maybe start going to thinking that examinations are not just a tagger. Maybe we should take examinations for looping that feedback into the system. So I think these are some of the changes which we can see right now. And let's see what holds on in the next 6 to 8 months, whether parents are actually able to continue this learning at home and then demand from school, okay, learning can be sorted from supplemental things, from technology. Maybe these are the 4 things we want from the school. And maybe this is what we want the examination to solve, and not just give a filter or not just give a tag to my child. So I think that amount of awareness, going behind the right parameters, is going to set in over the next few months. That's what I think might happen, but completely be a wrong judgment over the next few months.
Got it. So basically, we could see a challenge to the entire education system as it stands today. Understood. Kriti, before I give it to you, we've got just 1 minute left. So I just want to tell people whose questions have not been addressed, please do reach out. You can, either reach out to me or reach out to the founders directly. They're all on LinkedIn. They're extremely responsive and very easy to get hold of. So apologies if we've not managed to answer everything. And Kruti, just over to you to answer that question.
Yeah, sure.
Just one quick minute.
No, so I agree with a lot of what Ankit was saying. I think from what my sense is that this year is going to be very choppy. We will probably be closed for a while. We may reopen, but it'll be a phased reopening and then potentially close down again. So it's going to be a choppy year. I think what we had tried to solve with regard to access to school for every child is no longer solved anymore. Many children from the poorest communities, from low-income households, do not have access, right? They are completely out of they don't have access to a smartphone. If the parent does have a smartphone, they may not get that phone because a parent goes for work. They may have 3 siblings. And so one of the fundamental challenges for all of us that work in this space is actually going to be, how do we get access back to children that are the most vulnerable and from some of the poorest communities? Because children in the private schools are actually continuing to learn. They do have access. They are kind of progressing in terms of learning. And so this digital divide should not worsen. So I think that's one thing that I see as a flag, and I think something that we need to get ahead of and actually try to fix as soon as possible. And then actually think about what does a learning year look like, given that it's going to be choppy. What are the must-haves that we want a child to achieve at the end of an academic year at each grade, given that it's going to be some kind of a blended learning model? For me, those are the 2 things that we should look to think about over the next few weeks.
Awesome. Thanks a lot, Kruti. And thanks to the audience for participating and asking your questions. Again, as I said, do reach out after this. We've run out of time. I'm cognizant you have to go to other sessions too. But do reach out and we'll try and answer anything that's been left unanswered. Thank you so much.